So let's get into it. Thank you again. Thank you so much for having this conversation with me. And for everyone who's meeting you for the first time, can you let them know a little bit about you, who you are, and the wonderful work that you're doing?
Oh, thank you very much. I'm Dr. Risa Kagan. You can call me Risa. It's fine. I'm here in Berkeley, California. I've been a clinical professor at the university here and teach. I'm a board certified OBGYN. But for the last 30, 40 years, I've specialized in midlife and beyond women. I have been very involved in the Menopause Society, formerly known as the North American Menopause Society, doing clinical research, presenting, and also doing a lot of consumer education, and both in midlife and beyond women, female sexuality, as well as breast cancer survivorship, as well, and cancer survivorship, as well as bone health is very near and dear to my heart as well. So thank you for doing this. It's wonderful to get good, accurate information out to the public.
Absolutely. And that's one of my main objectives, obviously, with our conversation and with this collaboration with Vindico, because there's so much misinformation out there, especially when we talk about not only women in general, but when we narrow it down also to addressing the changes when it comes to demographics, and especially and depending also that if you're a woman of color, what should you expect? And that's why I'm so happy we're having this conversation. And in your experience, now that we're talking about misconceptions, what are some of the common misconceptions around these topics?
Well, a big misconception, and everybody comes in all the time asking, please, doctor, tell me, am I in menopause? Or tell me where I'm at. Or I want hormone levels drawn, or it's not like that. There are indications occasionally, like if a woman had her uterus taken out and she has her ovaries left, and it's unclear based on her history about what's going on. Clearly, we might have to do some hormone levels. But for the most part, we diagnose menopause, which is defined as a retrospective diagnosis where somebody looks back, says that was my final menstrual period. But the average age being 51, but the years around that final menstrual period is called the perimenopausal transition. Very few women go from completely normal to nothing.
Yes.
Usually periods start getting closer together, or you start skipping months. And when a woman comes in and says to me, I've now skipped 2 or 3 months, and then having all kinds of symptoms, and then all of a sudden I go through my whole spiel, and then they come back and tell me, oh, everything went back to normal for 6 months. So in that kind of, I say the perimenopause is like having PMS all month long. And then finally they really space out. And then so we really don't need to do all these urine tests, blood tests, measuring all kinds of levels, because guess what? Your hormones are fluctuating daily. And it's not, I mean, if I can do a test, but that just tells me what's going on that day and time. So we really want to gather symptoms. We want to figure out what we can do to help people, and to really get more information and do a really good consult to find out what's bothering somebody to help them. One big misconception. I'll tell you the other second biggest is that hormones are bad. Now, there are women that cannot take estrogen or progestogen if you have a uterus, are contraindications. But for most women, and every society endorses this, you should not be suffering in silence. We have great effective therapies. And believe it or not, if you are within those final 10 years since that final menstrual period, and you're under the age of 60 when you are considering starting hormone therapy, the benefits outweigh the risk for most women, unless they've had a stroke, a blood clot, breast cancer, uterine cancer, an absolute contraindication. And that message has been lost for the last 20 years. And many women are so afraid, and they feel like they're overnight going to get breast cancer. Overnight, they're going to get some kind of stroke, or, so we need to re-educate our public, but we also need to educate my residents, my medical students, my colleagues, my practicing, the colleagues that I work with for 20 years now have received very little medical education around the treatment of midlife and beyond women. So
for so they can make empowered decisions when it comes to these beautiful stages. Because if we see it and we take the lens, the shame out of the equation, it's just aging, and how beautiful that we get to experience that. But I know, for especially for my community, which is a lot of millennials, and you know, some of them might be older millennials already, even in perimenopause, and they don't even know it. And so you mentioned something about the symptoms, but can you tell us a little bit more insights in relationship between, you know, the fluctuation? What can we expect? For example, an older millennial or Gen X that is already perimenopausal, what can they expect besides, because what we hear the most is the hot flashes?
Okay, well, it's more than hot flashes. Although the hot flashes is the most common symptom, and it is usually something that can start happening even prior to that final menstrual period. A lot of women will come in and say, I'm having pretty regular periods, but the week before my period, I can't sleep and I'm up at night drenched. Well, then I know they're entering this stage, okay? So that is one. Another, as I told you, kind of PMS all month long. A lot of women start for the first time in their life having breast tenderness. You're going, well, how can I have breast tenderness if all of a sudden my hormones are lower? Well, it's not that your hormones are lower in that whole pre-menopausal time. It's that they're fluctuating, and sometimes they're sky high, and they cause breast and nipple tenderness, bloating. A lot of women feel depressed for the first time in their life. They feel anxious, depressed, and they feel like they're, they've never been like this before. So it's really, it's important to understand, all the symptoms. Not sleeping. They were a great sleeper. Then all of a sudden they can't sleep. Or women will come in and say, oh my God, the week before my period, I'm wired. I'm up at night. I can't sleep. All of those things tell me that
memory problems.
Getting to that stage where we need to have more education, more knowledge. Don't be afraid. We have plenty of great treatment options for women going through additional time.
And do you think it's always the same? And I know we have to wrap it up, but when we take in consideration the ethnicity, does it play a role? Do women of color?
There was this huge study that was done that showed that there's definitely racial and ethnic changes. Length of hot flashes, without a doubt, is longest and hardest even for Black women, and then Hispanic women, and then the ones with the least symptoms, believe it or not, in the shorter period of time have been Asian women, and Caucasian fall in there a little bit, in the middle. The average duration of hot flashes is the longest. And you know what else has been shown? That for, African American women, these symptoms start happening about 1.4 years prior to, earlier than other white women, equal white women, and Hispanic women even longer, earlier, 1.7 years. There's a very large study. If you were to just Google something called Study of Women Across the Nation, they even have, in lay terminology, they will explain a lot of these differences and changes. We have to do a better job, though, educating my peers, my colleagues.
Absolutely, especially because many of us, sometimes we might fall within several of those brackets. For example, me being Afro-Latina, I'm Hispanic, but I'm also Black. So but thank you so much for having, creating at least this spark in the conversation with my community. I know we will continue to create more content, and I thank you so much. I know you now have to go and join my friend Christine Borky from Fruit Loop Keeper, and you will continue the conversation with her. For all of you here tuning in live, I am going to save this and post it in my feed so you can go back and check. And also,
I want you to post one other thing on your feed, okay? The best place for accurate evidence-based information, www.menopause.org. That's the Menopause Society, previously known as the North American Menopause Society. It's accurate, has videos, really good information, and because there's a lot of junk out there. And you know what? There's a huge industry happening now where they're ripping off women. So, okay?
Thank you so much for this conversation. You guys go and follow Dr. Kagan in her next conversation, okay?
Bye-bye.
Bye-bye. Bye.